Hello, my name is Linmar Hefka, and this capstone presentation covers overcoming communication barriers in the long-term care setting. Effective communication in the long-term care setting can improve the quality of life and increase resident and family satisfaction. Communication in the long-term care setting includes interactions with staff, family, and residents. Communication creates connections to exchange information. When communication is effective, information is exchanged, understood, and comfort is provided. Effective communication is necessary to meet the specific needs of the elderly and can decrease loneliness and isolation. Examples of communication barriers in long-term care. Lack of time, overworked. A lack of time is the number one communication barrier, leading to a decrease in quality of care. Lack of skills. Skills are developed through experience. Ineffective communication skills, such as elder speak, used by staff, can cause an increase in dementia residents' negative symptoms. Pandemic. There are lasting effects on communication from COVID. Family is not visiting as much, and residents may be lonely. Ageism. Sight, hearing, and changes in the central nervous system that affect many over the age of 65, and processing speeds may have slowed down. Resident-family communication barriers. Building effective relationships and communication is based on the understanding of both sides of the interaction. Lack of awareness of staff responsibilities. One study shows that this is a top communication barrier for resident and family. Physical pain. When a resident is in pain, this can affect communication. Lack of trust. This may leave family feeling depressed, anxious, or condemned for putting their family member in a nursing home. Sometimes there is a barrier created when family members and staff have different views on what is best for the resident. Build trust at the beginning of relationships. Trust is the building block for communication, and it is important to build trust at the beginning of relationships. This can be done by introducing yourself, making eye contact, include and give attention to family. Use touch and empathy and acknowledge illness. For example, this must be a difficult time for you. It is important to provide consistent and honest health information to resident and family to recognize individual and family perspectives and create an environment where information is not withheld and trust and inclusion is fostered. Teaching skills. Teaching skills improves communication between staff and residents with dementia. Family members need nurses who can communicate effectively with confidence. New nurses need to learn how to communicate effectively, and this can be taught by the experienced nurses. Think family. Use each contact to enhance health outcomes, guard safety, educate, and support. Even spending small amounts of time with family or using purposeful conversation while conducting task-oriented care can help identify needs and concerns. Spread awareness. Teach others about the importance of overcoming communication barriers. Overcoming some barriers can be achieved by creating awareness. Raising awareness of the impact of potential communication barriers has significant benefits on providing quality care in the long-term care setting. Effective communication leads to resident satisfaction. More options for support are needed for nursing home residents, families, and staff to strike a balance between safety and quality of life. Overcoming communication barriers in the long-term care setting greatly improves family satisfaction and resident quality of life. Communicating with compassion can create healing relationships that improve health outcomes, satisfaction with care, and nurse satisfaction. Questions?